Greetings, everyone. My name is Mike Klassen, and I am the Vice President of Public Affairs at the BC Care Providers Association and Engage BC. And I'm pleased to be your moderator today for our Care to Chat Season 9 kickoff event, a special election panel. And before we start, I would like to acknowledge that we are hosting this meeting on the traditional lands of the Coast Salish peoples, including the Squamish, Musqueam, Tsleil-Waututh nations, and extend our appreciation for the opportunity to hold this dialogue here today. As many of us who have worked in Canada's continuing care sector know, elections often lead to disappointment. The issues we feel that are extremely important, such as funding for care, health and human resources, and meeting the increasing demand for seniors' care, are often given lip service in party platforms. The COVID crisis, however, has changed perceptions and attracted more attention by the major parties. Each has a set of platform planks that propose ways the next federal government can support seniors' care. We would normally be hosting an all-candidate meeting, as we have done for successive seasons of Care to Chat, but this time we decided to try something different, and we have brought together an expert panel of representatives from right across the country to weigh in on the party platforms and tell us what they got right and tell us what they missed as well. So we are very pleased to have Arjo as the title sponsor for Season 9 of Care to Chat. And we'd also like to acknowledge our silver sponsors, Care to Talk and Pharmacy at Safeway. Chris Pummel, Sales Director, Western Canada for Arjo, will now introduce our panelists. Welcome, Chris.
Thanks, Mike. Hello, everyone. Welcome to the 2021 Care to Chat Series Election Edition. I'm Chris Pummel, Western Region Director of Sales for Arjo Canada. At Arjo, we believe that empowering movement within healthcare environments is essential to quality care. Our products and solutions are designed to promote a safe and dignified care experience for both residents and their caregivers. Through innovative patient handling, personal hygiene, medical beds, and pressure injury prevention solutions, we're committed to driving healthier outcomes for people facing mobility challenges. The Care to Chat series invites key opinion leaders and experts to share their ideas, thoughts, and insights, as well as engage in an open dialogue about the important and emerging issues that are facing British Columbia's senior living and care sector. At Arjo, the health and well-being of seniors in care is of utmost importance. Gathering key decision makers from seniors living and care sectors, government and health authority representatives, health professionals, as well as seniors and their families, strive to create a positive and productive discussion to improve the everyday lives of the people we care for. As we begin the discussion today, I'd like to take the opportunity to thank the BC Care Provider Association for organizing and hosting this Care to Chat series. I'm looking forward to listening and learning along with the members attending the sessions. Now, without further ado, I'd like to extend a warm welcome to the upcoming panelists for today's sessions. First, I'm to introduce Laura Tamblyn-Watt, President and CEO of Canage. Laura is a highly sought-after expert regarding matters involving older adults in Canada and around the world. She currently teaches at the University of Toronto, where she is also a fellow of the Institute for Life Course in Aging. Next, I'd like to introduce Jodi Hall, CEO for the Canadian Association of Long-Term Care. Jodi served as Executive Director of the New Brunswick Association of Nursing Homes since 2017. Hall is also the President of the New Brunswick Continuing Care Association and co-chair of the Collaborative for Healthy Aging Care, which works to create a shared conversation among stakeholders on the aging experience in New Brunswick. In addition to her work in Eastern Canada, Hall is no stranger to the Canadian Association of Long-Term Care, or National Advocacy, serving as the chair for the past 2 years and as the vice chair in 2018 and 2019. Next, I'd like to introduce Terry Lake, CEO of BC Care Providers Association. Terry trained and practiced as a veterinarian and taught animal health technology before entering public life as an elected representative. He served as councillor and then mayor of the city of Kamloops, and then was elected member of the legislature for the riding of Kamloops North Thompson in 2009. He served as the Minister of Environment from 2011 to 2013 and Minister of Health from 2013 to 2017. He was awarded the Canadian Public Health Association Public Health Hero Award in 2017 for his groundbreaking work on the opioid overdose crisis. Looking forward to hearing your insights today and appreciate and thank you for your participation. Thank you, everyone.
Thanks very much, Chris. Welcome, panelists. Very exciting to have you all here. So we're going to give you up to a couple of minutes each to set the stage for today's conversation. I'm going to begin with Laura. Welcome.
Thanks, everyone, and bienvenue tout le monde. It's really wonderful to be here today. I am often just where I am in the background near Whistler, BC, but today I'm coming to you really as a pan-Canadian person from Nova Scotia. When we're thinking about the issues that we're addressing in this election, they are also pan-Canadian, and I think that's important to know that the experiences in British Columbia are sometimes the same and sometimes different than the experiences in different parts of this country. But what is the same is that seniors issues have really needed to take a focus and a stance. We have seen the federal government really for the first time lean in a little bit past their usual deference to the provincial sphere around most seniors issues, with the exception of sort of tax code stuff, and actually talk about things like home care, talk about things like long-term care, discuss the concepts of national standards and so on. And that is unusual. It's really been a first time. I've just put in the chat here, canage.ca/election21. I'll talk a little bit later about what the different parties are promising. But if you would like to have a quick jump and at any point have a look at that, we've broken out all of the party promises, and we're hosting some town halls later this week with different party leaders as well. So what I want you to take away this is that seniors issues are on the minds of the politicians. They're certainly on the minds of the voters, but we've been disappointed at Canage because none of the political platforms, really, with perhaps the exception of the just re-released Green Party platform, have taken a holistic approach to the issue. So we've seen the NDP take a very idealistic point of view. We've seen the Conservatives take a more niche point of view of trying to fix individual pocketbook issues. And then the Liberals haven't really necessarily stepped up into that middle ground that we expected them to do so. So there is some money, there are some promises, but it's not that transformative set of systems that we were really hoping for. So excited to talk about this election chat and what it means to Canadians across this country.
Thanks very much, Laura. I'm going to turn it over to you now, Jodi. Welcome.
Thank you, Mike. And I really appreciate the invitation to join the Care to Chat session today. Very exciting time. It really has been a very remarkable 18, 19 months in long-term care in Canada. We've seen these long-standing chronic systemic issues that really have been great challenges for the long-term care sector really become catalyzed through the whole pandemic, and been very difficult to see that unfold. The reality is that these challenges that we all saw play out through the media are not new. These are challenges that have existed for a very long time in the Canadian Association for Long-Term Care, along with all of our members, many of whom are participating today, including BC Cares. Have done a great deal of advocacy work with the federal government to raise profile on these issues, to discuss what the policy opportunities are, and where there is level for much deeper engagement on the part of the federal government. I believe that we're at an absolute critical time, and that collectively as a country we need to turn our focus to the aging experience in Canada and the role that long-term care will play in that. And of course, in the midst of a federal election, I have to point out, as someone who's had a lifelong career that began in high school in long-term care, this is the very first time that I've seen commitments made in all of the federal party platforms that address long-term care. So that in itself is remarkable and absolutely noteworthy. And, some of them are, we see some common positions being taken in these platforms, but some that are very unique, as Laura has very clearly articulated. So I really look forward to the panel discussion and interacting further with all of you.
Thank you very much, Jodi and Terry. Welcome.
Thanks, Mike, and thank you to everyone participating today, and thank you for all that you have done over the last year and a half working in long-term care, whether you are a director of care, HR director, an owner, operator, or healthcare aid. You've endured a remarkable 18 months, and we're not out of it yet, but I know the whole country is appreciative of your efforts. I was health minister under a conservative federal government and also a liberal federal government. So I have a sense of how these two parties generally approach healthcare and generally approach things like national standards. And they're quite different, as Jodi and Laura have pointed out. While there is some head nodding to seniors issues, because it's been, 6-8 months since we saw a lot of deaths occurring in long-term care, you can see the interest in politicians has fallen off a little bit. They started out of the gate in the throne speech and in the initial platforms talking a lot about seniors. And as the campaign went on, less and less talk about seniors. And as Laura mentions, no transformative change. In fact, the only really transformative change that I can see in any of the platforms is around childcare. But that's not a surprise, because transformative change is really hard. And unless you have a really solid majority government, it's very difficult to do. We know things like free trade agreement, GST, those were transformative, and we haven't seen much of that in the last decade or so. So I'm looking forward to the discussion today, looking at the commitments made by all parties and the role we can play as a sector in working with the new government that hopefully will be announced on Monday, although it's too close to tell at the moment. So back to you, Mike. Thank you.
Thanks very much, Terry. So just for our audience today, just a few logistics. We are going to be asking questions throughout to our panelists. We're inviting other people to come in and ask questions. We've got 3 people coming in from across the country from different organizations who are also going to be asking questions. We're going to try and leave some time for your questions as well. You can see in the chat box that we are encouraging you to submit your questions in the Q&A box, and they're going to be gone through by Rebecca, and hopefully we'll have some time at the end of this discussion. So I'm going to now turn back to Laura. And Laura, it's been such an incredible experience working with you over this last period of time. You've been able to be not only a national voice for this sector, but you've managed to create and build Canage from the ground up. Canage has been extremely active. You already pointed out the link to your election platform page, but you have some interesting ideas on how to fix seniors care. So I thought maybe just to start things off, you might tell us, summarize about some of those ideas on how the next Canadian government can improve the lives of seniors being supported at home or in our care homes.
We've been so interested to see how governments are focusing on it. And let me just start off by giving you a little bit of an overarching policy platform on how we've approached understanding these issues. So we created something called the Voices of Canada's Seniors, which I'll put in the chat, but you can certainly go to canage.ca/voices. And we created 6 major compass points. So we're thinking about what is it that seniors need and want? So we looked at violence and abuse prevention as the V, optimal health and well-being, infection prevention and disaster response. And then we talk about C as being kind of that caregiving continuum of long-term care, home care, and so forth. And then economic security and social inclusion. And we use that same framework to provide recommendations. So I'm going to brag a little bit. We have 100 policy recommendations that we've given dispersed amongst the various party platforms. So what we know is that if you can give political parties real solutions with pre-sign off from stakeholders and say, this is something that has already been curated and supported by key folks, here is an easy answer to some of these problems, they will take them up. So that's an important learning, that there are really good things embedded into the different platforms. But what we've been missing is that transformative change, that big picture piece. I'm going to take a moment and just share my screen. And again, I invite you to have a quick look at canage.ca/election21, just to kind of share with you our kind of big 3. And I'll try not to scroll too quickly. So the first piece that we really focused in our top 3 is fix senior seniors care. And we tried to be really clear when we're talking about that. This group is very expert. We know the many challenges that have been faced for decades, but it doesn't mean that we don't get to fix it. You know, the idea of the division of powers in 1867 was not to create finger pointing, right? It was to create clarity around solution making. And healthcare is one of those shared areas of priority. Now, as we know, there are some provinces, Quebec and Alberta, and I would say sometimes Ontario is being a bit chippy about this, who really don't want to be, quote, told what to do. And so they'll talk more about healthcare transfers, but we don't think that's enough. We're suggesting that what we need is a seniors care transfer. And this has been picked up, I think, in some ways by each of the parties, a pocket of funding that you can negotiate with the provinces to fix seniors care, because we understand that in Nunavut, it may not be the same exact breakout of issues that they need to spend money on as they do perhaps in the lower mainland, in Vancouver or in the GTA. So when we're thinking about a seniors care transfer, it sits side by side with the Canada Health Act. It doesn't compete with it, because I have to tell you, as a lawyer from way back, if you open up the Canada Health Act, we're going to get stymied into constitutional issues and we're not going to get anything done. So that's been our first recommendation. Do you remember when we used to talk about baseball and hockey statistics, right? How the Canucks are doing against the Leafs? That's a bad conversation to have in many cases. But we now sit around talking about adult vaccinations. We talk about mRNAs, we talk about R rates, we talk about which vaccines you got and so forth. And yet we haven't seen this government take seriously the notion of adult vaccinations. And we know that that has been true in previous governments as well. So we can't blame Trudeau. It wasn't done under the Harper governments, and it wasn't done under Chrétien, and it wasn't done under Martin, and keep going back. But we rank some of the bottom in the OECD around adult vaccinations. Only about 8% of Canadian seniors have their adult vaccinations. 8. And if you look into some more committees, some of the smaller groups, you'll find that it's as low as 3%. So what we're asking is that we take adult vaccinations seriously, not just COVID-19, but redo it. And we know exactly how to go about doing it. This is just a matter of actually moving forward with things like shingles and influenza and Tdap and so on. And for our British Columbia colleagues, you know, we have some of the worst vaccinations in Quebec, in British Columbia, and we do a very poor job of funding adult vaccinations as well as making them available. And the last are pocketbook issues. And whether it's looking to try to stay out of seniors care, whether it's about affording your prescription medications or keeping the heat on, or trying to make sure that people are able to take their retirement funds and stretch them as long and far as they can, we know that adult financial well-being is going to be a key point. And each of these three highlighted areas have been differentially impacted by the pandemic. So we know that people who are getting ready to retire may not be able to. Interest rates are at historic lows. We know that costs have been rising. House prices are very high. So if you are able to sell your house, you might get a good price if you are a person that is in the home ownership elite, but you can't buy anything for less. So that's the problem. It's not like you can move to somewhere cheaper usually. And if we're looking at the costs of other types of economic impacts, we know that they're hard. So I just want to close by showing you this. We have broken out each of the party platforms, and you can very easily scroll again at canage.ca/election 21. And we have broken out each of their platform promises to deal with older people. And I'll just show that if you continue down, you'll be able to navigate through all of the different party platforms and see that. I will again give you a flag that the Green Party just dropped an entirely new platform, and it is extremely robust, but I probably won't be transformative to this election. So here's what I want you to take away. We know that people, as Jodi is saying, you know, are starting to think about seniors issues. There hasn't been that enormous focus, but again, seniors vote. 80% of the seniors population votes, the largest voting group in the country. And very often the conversations have been about younger voters. We know that with students being on campus or off campus or not able to vote as easily, the student vote may be down. That tends to sway to the left. So we will see, but I predict this: whoever wins the senior voters will win this election.
Thank you very much, Laura. great overview. Looks like a huge amount of work went into that website. So obviously everybody check out the link at canage.ca. I'm going to now go to Jodi Hall, the first ever CEO of Canadian Association of Long-Term Care. I've worked with Jodi for quite some time, and very excited to have her as the new leader of this organization, right in time for a federal election as it happens. Jodi, maybe you can start by talking a little bit about some of the things that CALTC has put forward that they are proposing that the next Canadian government looks at.
Great, thank you, Mike. And yeah, we went through the exercise with the membership across the country to try and narrow it down to a maximum of 3 recommendations, which is always a challenge because there's so much that we all want to see happen and identify as points of collaboration with government. But it's interesting because like Laura and Canage, one of our areas of recommendation, we are calling the Canada Senior Care Transfer. And so we're definitely on the same wavelength with Canage in that. This is something that we see outside of the Canada Health Transfer. So it's a brand new kind of vehicle of funding from the federal government to the provinces, but dedicated for home care and long-term care. We've seen the recent example with the Liberal commitment for mental health transfers. So we do believe that there is a possibility to see that happen, and we actually see that reflected in the Green Party platform as well. So the second recommendation that we've put forward for the new government from CALTC is the creation of a national health human resources strategy. It certainly has been well publicized that this is an area of crisis in Canada, something that all homes have struggled with, certainly before the pandemic and of course during the pandemic. And you know, we think that with a national approach, with the federal government's leadership and coordination, you know, there's great work that can be done with immigration policy that better connects newcomers with the long-term care sector, building capacity in education and really that whole domestic workforce development. I think there's great opportunity in that, and you know, making sure that we have the mental health supports and resources available for our existing workforce, so that we're making sure we're caring for their resiliency and wellness as well. So there definitely are examples of these within the platform. Certainly mental health plays you know, prominently throughout them. But you know, how they'll be able to work with the provinces, I think is one of those really outstanding critical questions that we'll need to really engage with the next government on.
Terrific. Thanks very much, Jodi. So Terry, you've been extraordinarily busy. We've had some major announcements in the last few weeks around mandatory vaccination for staff. I think there's some people who think BC care providers had some effect in some of those decisions. And so you also bring to this current election the experience of being a BC Minister of Health, and as well as being the CEO for BC Care Providers. You've had a chance to take a look at the party platforms. We've heard Laura's thoughts about how transformative or not that they are, but what are your sort of key takeaways? What are a couple of things that you think that we should be looking at in these platforms?
Well, I think we have to limit our expectations, and to Laura's point about the federal government and jurisdictional challenges and arguments and finger pointing, it's just the way this country works, unfortunately. I can tell you at the federal, provincial, territorial meetings, the provinces are not going to let the federal government tell them what to do in areas of their jurisdiction, which is, of course, health. That's why many provinces say just increase the health transfers and let us design the health needs of our population, which is the way it's supposed to work. And so the Conservatives, for instance, have said that they will increase the Canada Health Transfer, I think by $30 billion over 5 years. That's significant. The Liberals have said they will increase the transfers to a degree, but they've also talked about a mental health transfer, and they've talked about national standards, which would be much like we did in 2017 when we added the home and community and mental health top up to the transfer. So that is one way that the federal government can influence provincial health, is by sending money. And the Liberals like to attach strings to it. The Conservatives don't. So that's, would be interesting to see who wins, because those are the two parties that have a chance of forming government, and there'll be different approaches. But I think the biggest way that a federal government can help is looking at the file they hold all of the cards in, and that is immigration. We, our biggest problem is health human resources. We need more people to be working in this sector, and we've seen the hours of care are going to go up. Well, who's going to fill those jobs? The Liberals have pledged, I think, 50,000 PSWs or healthcare aides training, which is helpful. Still not enough to meet the demand. So we really need recognized immigration pathways, working with the Association of Regulatory Nursing Colleges across the country to make sure the credentials of foreign trained nurses are recognized faster. And let's get them into the workforce. This country was built on immigration. And I think without immigration, we won't solve our HHR crisis.
Thanks very much, Terry. So we're just about the halfway point of today's Care to Chat, our election edition panel. The start of season 9. It's our national discussion, and we wanted to make it more national by inviting some national voices. So we have one person who is going to ask the panel a question, who is from Nova Scotia. In fact, it's Mary Donovan, and she is the director of a member and partner services, and she is with Health Association Nova Scotia. And Mary, if we can get you to turn your camera on, I think you have a question to ask the panel. Welcome, Mary.
Thank you. Thank you so much, Mike. It's a pleasure to be here this afternoon, and thank you for sharing all of your perspectives on these really important issues. It's great to participate in this dialogue today. So my question to you is with respect to the pandemic response in Canada. Some of the provinces have been criticized for over-politicizing their COVID response. What would be your advice to whomever forms the next government when it comes to promoting awareness and supporting efforts to stop community spread of the virus?
Okay, so I'm going to turn that, great question. Thank you very much, Mary. So I'll turn that question back to the panel. We'll come in I'll make this a little more random, but I will start with Laura on this question, and maybe go to Terry next.
Thanks so much, Mary. And what a great question. Because of course it is political, isn't it? And we're seeing the different flavors and tones and tenors about different politics. So you just have to watch, Ontario as an example compared to Quebec, and very different dialogues and very different discourses on it. But this is a federal question. And I think the advice I have is, really embrace your public health mandate. Unlike the health transfer mandate, the public health mandate sits nicely in the federal government's avenue. And so we need more and better information, but we also need them to centralize and approve something. So this is actually a little bit of a technical answer. Anyone who's been watching NACI may not perhaps know that they're really a volunteer organization of people who have other jobs doing things like running entire departments on epidemiology. Canada is way behind taking its public health mandates seriously. And so we need to actually transform NACI into an grown-up organization with paid people at arm's length. And we need to do vaccine purchasing centrally, and then give that vaccination availability to the provinces for distribution. The federal government can do a lot of real good here, as well as communicating to its diverse communities and depoliticizing some of that. So we're talking about vaccine hesitancy. We need to better understand why people are feeling vaccine hesitant. Are they not getting the information in a way that makes good cultural and linguistic sense to them? So leadership in this area is ripe, and we are at the bottom of our comparator countries on it. So that's my recommendation. Go up the middle and get the job done.
Fantastic. Yeah, NACI's had its reputation battered and bruised a little bit over the time of this pandemic, and that's, I think, very interesting advice. Terry, I know that you look at the politics of these things, but how do you imagine the federal government could help channel those ideas that Canadians need to hear to try and better protect ourselves from the spread of the virus?
Well, I agree with Laura that we need to have more leadership on public health, and having a professionalized NACI is one of them. Making sure we have a national stockpile of PPE and pandemic preparedness, and making sure we have supply chains for vital components of fighting pandemics like vaccine manufacturing available to us. You know, we all got caught up in globalization, which has reaped many, many benefits for people around the world, but we've forgotten. And this doesn't just apply to infectious disease. I mean, most of our pharmaceuticals come from India, and we've, you know, that leaves us at risk as well. So I think the federal government can take the lead. Now they have in many ways, working with the provinces, and they can't impose a lot of, even though it's nice to say we have a chief public health officer for Canada, they actually can't tell the provinces what orders to pass and what regulations to put in place. But they can show leadership, and it's very difficult for provincial government or provincial health officer to go against those recommendations from a professionalized NACI, for instance, and certainly the coordination of public health software. We had the Panorama system that was supposed to be that national software to track public health, and it fell apart because Alberta, you know, decided not to participate. A couple other provinces decided not to participate. So we really have to make that commitment at the federal, provincial, territorial table to bring us all together to have those national templates that we can use in times like this.
Jodi, just to kind of round out this discussion on Mary's question, you're based in New Brunswick. Atlantic Canada obviously got a lot of credit for doing things differently in some ways. They were, some of them were potentially aiming for COVID-0, didn't quite work out that way. But you know, how is the experience in Atlantic Canada perhaps a model for Canada to look at in infection prevention and control?
Well, I can speak best to the experiences in New Brunswick because I was involved certainly at the time when the pandemic really began in this province last March, I guess was our first encounter of all of this. One of the things that this province or this provincial government did do correctly was they had a much higher level of emergency readiness than perhaps other provinces. And one of the big advantages that we had right off the bat was they had maintained a pandemic warehouse. So when everyone was struggling to find PPE across the country, we did have a supply available to us. You know, there wasn't exactly everything that we needed. I don't think people thought about, you know, a floor cleaner and hand soap as things that needed to be included in a pandemic warehouse, but just that early preparedness and the ability to respond quickly was something that was incredibly helpful here.
Thanks very much, Jodi, and thank you very much, Mary. Great to see you all the way from Halifax, Nova Scotia today, and welcome. Great to have you here, and enjoy the rest of you. I know it's late there, so we're kind of halfway through the day here in BC, but thanks again for your question today. So I'm going to go now to a discussion just again about talking a little bit more about what happened during the pandemic. We know that long-term care particularly was hit hard. The seniors care sector was particularly hit hard. We've had the benefit now of 18 months to look at what happened. We've had dozens of reports that have been produced. And so I have a question I'm going to pose to Laura first. If you had a chance to sit down with the Prime Minister, the next Prime Minister, what would your advice be to them on how to prepare for the next pandemic?
Part of it is, you know, we knew pandemics would come because we can look around the world and we've had them before. I remind you of SARS, the other SARS, right, that we had in the early 2000s. And for those of us in British Columbia, we'll remember all too well the concerns about flights coming in and some of the preventive measures. I had young children at the time, and I remember being worried about that. We had the swine flu. I remember getting, you know, our kids jabbed for these types of things. And we always are thinking about influenza. We're always thinking about things like bacterial and viral pneumonias and which of those we can get and which of those, you know, can be prevented against. Before that, we thought about smallpox. Before that, we thought about polio. And I certainly have my little scar from the chickenpox, and I'm about to get my shingles vaccine this year. So all of these things are completely predictable. And the very best thing we can do is actually enhance public health and really get serious about making sure that we have preparedness, that we have science-based decision-making and evidence-based decision-making, which we've seen some of and some not of as much, and that we actually double down in making sure that we are able to create domestic production. You will see domestic production as a key promise in some of the platforms, including the conservative platforms, so we don't get caught up in that global crunch. So many of these vaccines, of course, like influenza vaccine or shingles vaccine, they're open markets. And if we don't buy them fast enough and order them in a timely fashion, they will get sold to other people who want them. So we've been very lackadaisical. We have a really easy way of implementing, local investment in Canada. We have systems in place and we have solutions that we know work. It's simply a matter of taking our public health responsibility seriously and keeping not just people alive, but those people keep economies going too.
And as you point out, we could really do a better job just in terms of our own domestic production and responsibility on that one. Just before we move off of this question, anybody else have that elevator pitch they want to give to the next Prime Minister? How you think we can better respond to what people are saying now are inevitably going to be the next pandemic? Jodi, any sort of quick thoughts on that?
Yeah, I, certainly agreeing with Laura's comments, but, really coming together to have that Team Canada approach. It's true the federal government and provincial governments have key areas of responsibility, but, the coming together so that it's not at odds and that we're able to collaborate through all of that. Having an approach to shared policy development and then working with some of those higher risk settings, like we know long-term care experienced, making sure that we have the information even before we need it, and the resources to continue to fight is, I think, really about that overall emergency pandemic preparedness. I see the platform commitments that is highlighted throughout them, and it's an area that I would continue to flag as having critical importance.
Perfect. I might just, Terry, do you any final thoughts on that particular question? You get to
No,
sit
not
down
really,
and-
Mike. I think we covered all of it on pandemic preparedness.
You bet. Fantastic. So we're going to talk about long-term care standards, and I'm going to start things off with Jodi Hall. Jodi, the crisis caused by COVID-19 really impacted Canada's long-term care and retirement homes and led to a public outcry for action by the federal government. And the political response was to strike committees. Laura is on one of those committees to establish national long-term care standards. And while the process is just beginning and it is unclear how the provinces will ultimately adopt the recommendations, what does CALTC want from the next government in terms of long-term care standards?
Yeah, thanks, Mike. Well, I'll start by saying that CALTC is supportive of the development of the national standards, and I am sitting on one of the working groups under the CSA's technical development efforts in that. When I talk to long-term care operators and leaders across the country, one of the areas that keeps getting flagged is, will we have the resources to be able to implement these standards successfully? No one wants to be set up for failure. And having standards is not new to the long-term care sector for sure. So it becomes a really critical component that with the introduction of standards must come the introduction of dedicated funding that supports their successful implementation of that. And just to quickly go back to one of the areas of recommendation, that we've put forward from CALTC for the election under that national standards heading is the need for standardized data. If we're going to introduce standards, we need to have a way to nationally understand their impact and sort of where our ongoing challenges are, where we're doing really well, and a way to have that shared picture of what's happening in long-term care across the country. And we also understand that there will be new design standards for long-term care homes coming forward as part of this work. And so that brings us back to those critical questions around infrastructure and how we access financing for infrastructure development in Canada. It's not easy to do. So there are some absolute opportunity there for the federal government to work with the sector in supporting bed renewal and development as we move forward.
Thanks very much, Jodi. And just noting the time, we have a couple more people who are going to come in and ask questions. And the first of those two people is Lisa Levin, who's the CEO from Advantage Ontario. Lisa, I know you have a question for the panel. Welcome from Ontario, and you have a question, so please share that with us.
Great. Thanks so much, Mike. It's great to be here today to listen to this important conversation. So the panelists have talked about health human resources a few times. This is one of our top issues across the country. And the federal parties have each provided a range of platform promises to address the labor crunch in seniors' care, ranging from more recruitment and training to raising worker pay. So I'm going to start with Terry. Terry, how would you rate the different parties in terms of their platform pledges in this area? And is there anything that's missing?
Thanks, Lisa. Well, certainly the Liberal platform includes training for 50,000 healthcare aides, as I mentioned earlier. They've also made progress on immigration pathway changes through the new tier system versus the knock code system that we had before. So, and the Conservatives have certainly given a nod to immigration, but you don't see a lot of information about how they would address the HHR crisis. If I got to talk to the next Prime Minister, I would say there's two things that are an existential threat to this country. And Mike knows these very well because we've talked a lot about them: climate change and our aging demographic. And unless you wrestle with those two, and these are both problems that we've known have been coming, but until they're in your face, you don't deal with them. I can tell you from someone who lives in a community where from my deck I could see a neighborhood on fire this summer, climate change absolutely is existential, but so is seniors care and seniors needs. The demographic, look at the baby boomers in front of you, that is all coming, and until we deal with that now, if we don't deal with that now, we will be totally unprepared. We're going to have to spend a lot more money. I'm a bit agnostic on national standards for the reasons I've elucidated before, that squarely in the provincial realm, and Quebec will do what they want to do anyway. But I do think that the federal government can do so much on the immigration pathways, and working with regulatory bodies across the country to make sure we credentialize those people that have trained in other countries, we've welcomed to Canada, but they're not able to carry out the work that they've been trained to do.
Okay, great. Mike, did you want me to ask that question to the other panelists, or are you moving on?
I'm going to probably keep going, Lisa, but if anybody wants to add more to the HHR question, absolutely. Thanks very much, Lisa, for joining us in here today. Great to see you again, and great working with you on this file.
Yes, thank you so much.
So I'm going to just shift gears a little bit and start talking about a care at home, because we know the vast majority of seniors will get either their care at home or live out their lives in their home rather than go into long-term care or assisted living. I know that there are some interesting ideas out there to support aging in place. You've had a chance to look at some of the party platforms, Laura, and what are the best ideas out there, do you think, that are out there regarding supporting aging in place?
So there's some good ones, actually. There's some good news in this particular area for kind of pocketbook Canadian issues. We see really almost each party coming up with something around the caregiver tax credit. We might take a little bit of credit for that one because we got it into most of the political parties. And that is that the caregiver tax credit right now, you have to earn money in the workplace. And you, of course, have many challenges doing that because if you're a full-time caregiver, you're probably not in the workplace. And in the same way that it would be often able to do so, the offsets there. So refundable tax credits, meaning you just get to write it off the top. That's a good one. It's not a lot of money. Let's be clear. It's not solving all of the problems, but it's a step in the right direction of understanding that some people can afford to use tax credits. Not everyone can, but that's helpful. A next piece, again, is around aging in place, around the physical built environment of your space. So one of the big changes that we've seen adopted by most political parties was to have either a per person tax credit for disability modifications to your home, as opposed to a per household, which it is right now. The Liberals have changed that up. They've said that they'll double it to $20,000, which indicates really that they think a lot of people are couples, but they've added an intergenerational point in there as well. So really, those are good pieces, up to $10,000 typically right now. And now they're bifurcating that and either adding it as a per person, or again, in the Liberals' point of view, it's a doubling plus an intergenerational. Those can help people stay if you put a ramp in, if you change the bathroom and those kind of things. We're seeing, of course, the Liberals have talked about their Aging Well program, $90 million to community-based organizations over years. Again, it's a good thing to have, but it's not really solving the key existential crisis that we are facing. It's not really community-based organizations that are going to solve that problem. It's really going to be home care that solves that problem. And we are not seeing a lot of tethering outside of the NDP and the Green Party. So we've seen before home care transfers kind of go into the general coffers of the provinces and not actually go to home care in many places. And so the aging at home piece and the federal government is starting to have to use these pocketbook issues. What we have not yet seen are investments like their childcare investments move to aged care. That type of future state would be useful, and we're not there yet.
Thanks very much, Laura. So I'm going to move to a subject that is very much in the news right now. We're going to talk about vaccinations, and I'll probably start with Jodi. There's been a lot of debate and discussion about mandatory vaccinations. Of course, the entire healthcare system here is now required to be fully vaccinated in British Columbia by October 26. These vaccine passports are now being rolled out in several provinces. With hesitancy still being a big problem in many communities, what role do you think the federal government could have in ensuring that as many people get vaccinated as possible?
Yeah, thanks, Mike. Well, first of all, the Canadian Association for Long-Term Care has taken the position to support mandatory vaccination for long-term care employees, and we support the efforts of all of our members who've gone to great lengths to support their employees and make sure that those vaccination levels are there to ensure that we're protecting the residents, which is really what it's all about. You know, when we talk about, you know, the role of the federal government, we have to, as we've mentioned many times here in our discussion, we have to think about this division of power between the federal and provincial governments. And so much of this does fall to the provinces, but certainly at the federal government level, I mean, at the highest level, making sure that we have a sufficient vaccine supply. And you know that they're working with the provinces on logistics of how to move those vaccines to every individual who needs them. But you know I keep saying this, but it just is such a critical point for me. You know, in these platforms, we see so much of the what needs to be done, but not a lot on the how. So you know, any party that forms the next government really needs to be able to work with the provincial governments to create plans that kind of reflect, you know, the unique perspective of that individual province, and you know, ultimately achieves the goal of making sure there's accurate information that's flowing from the federal government to the provincial government.
Thanks very much, Jodi. And I know that the others will probably have a lot of things to say about vaccine and vaccine hesitancy. I might get you to save them for some of your closing remarks. Just again, noting the time. We have one more guest to join us here on the call. It's Wayne Morishita. Wayne is the Executive Director for the Alberta Continuing Care Association, also a member of CALTC. And it's great to have Wayne representing here, the voice of Alberta on our national discussion here on the Care to Chat. Wayne, you have a question for the panel. I know that it's an interesting one, so please go right ahead.
Great. Well, thank you very much, Mike. And again, thanks to BC Care Providers for pulling together this panel and discussing these, this a critical topic given our national election that's going on right now. One of the more controversial proposals that we've heard during the federal election has been made by the NDP and more recently by the Greens, and it's to end private for-profit delivery of long-term care. Can I get the panel's general thoughts on this, including whether you think this is realistic or even feasible?
So I might start with you, Terry, and go around the panel because I'm really interested in hearing. And thank you very much for the question, Wayne.
You know what I'm going to say, Mike. First of all, they don't have the power to do that. So it's typical idealistic ideology in the form of a commitment. But even if they could, what would spending billions and billions and billions and billions of dollars to essentially expropriate properties and businesses from the private sector do other than cost a lot of money? It wouldn't add one bed. And when you look at that RBC report that I was referencing earlier about climate change and the aging demographic, the need for a huge increase in all seniors living facilities, homes is critical. So let's not worry about the model of ownership. Let's talk about outcomes and, certainly performance tied to outcomes. I'm really worried that what will happen from going through COVID-19 is that we'll have more and more regulations to prevent what we saw in Ontario, where we have more for-profits, but also what we saw in Quebec, which is 80% government owned and operated. Let's get away from that argument. Let's talk about how we make the care and the outcomes, not the checking the boxes, but the outcomes for our residents better. That's where we should be starting that conversation, not about who owns the home.
Thanks, Terry. Jodi, this is a question that won't go away. It gets asked a lot. I know that we take these discussions seriously, but what is the view of CALTC on this discussion?
Yeah, well, I mean, very direct. We don't see this as feasible, and I'll elaborate on why. But many of my comments will reflect Terry's. We know that 29% of the long-term care homes in Canada fall under this category, and that's from the Canadian Institute of Health Information. And I think often in the discussions, people have a sense that that number is much higher, and in fact, it is not. And so that is really important that when we talk about something that could have a national lens, that we have the national numbers that we're considering as part of that. And, there are some variations between the provinces and how their long-term care models operate. But there are some things that are very similar. And one of those things that is largely similar is that funding comes to long-term care homes in protected envelopes. So on the provision of care itself, there is not profit that is allowed on that. And any funds that are left over on those critical line items in the budget have to be returned back to the provincial governments. So, that's critical to know as well. And I think it's also really important to note that although these homes are, not owned by the public, they are very much part of the public system already. So they receive the same budgets as all of the other homes, and they are subject to the very same regulations as all of the other homes under the variety of models that exist across the country. So when we consider all of that, and to Terry's point, at the end of the day, it would cost billions of dollars for these homes to be purchased, if they could be purchased. And we wouldn't have added a single bed. We wouldn't have made investments in care improvements. And even if it did happen and it could be achieved, we would still have homes that are still subject to the same provincial budgets and the same provincial regulations. So we have to ask what would ultimately be achieved at the end of that. And like Terry, for me, all that has happened over the last 18 months, we need to be focused on the residents. We need to make sure that we're making investments that are critical to their well-being, and that we are being focused for the future of what aging needs to look like in this country and what role that we can all play together in that. It's all hands on deck, as we're at a very remarkable crisis point in this country for long-term care. And so this is one for me that I would absolutely say is not a feasible position.
Thanks very much, Jodi, and thank you very much, Wayne, for a great question. I'm going to, at the risk of sounding like a moderator of a recent English national debate, I'm going to press on your ability to keep things tight. I'd like to promise that we'll finish things up on time. We may go just a little bit over, but Laura, I know you want to weigh in on this topic, but I'm going to see if you can, because I know how good you are at this stuff. I'm going to see if you can incorporate a question that came off of our chat board here. Aaron Baudouin from Vancouver Island has asked about how are we going to address the lack of beds, whether they be public or private in Canada. We know that this is a massive growth that's going to be happening in the next several years. And then what I'll do is I'll kind of go backwards with Jodi and Terry just for some final remarks. And then thank our sponsors, and we'll close things off. So everybody give us a couple more minutes. Thank you.
Thanks very much. And actually, I'm going to jump in on Judy's one as well, as how can we hold politicians to their commitments in long-term care? So I think that perhaps we should have, in fact, included long-term care in 1987, except for the fact that we really only lived till 76.4 years in 1987. We were drafting the Canada Health Act, and we didn't have long-term care because people just essentially died. And we didn't have these longer periods of time with increased frailty and increased complex needs in the way that we're thinking about right now. Having said that, that ship has sailed. In our pragmatic view, what we need to do is think about how is it that the entire care continuum is being supported. So we do think national standards are good, as well as the money to support those standards. That means staffing, that means the physical built environment needs to be included, and we need to make sure that the level of quality comes up all around. How do we hold positions? I think, we're seeing right now that people are voting with their feet on this election issue. I think the politicians have not gauge the degree of fury that people have about what's happened in COVID-19, and particularly around seniors issues in COVID-19. So I can tell you Canage.ca will be holding people to their feet. So join for free. And the backlog of beds is real. I would just talk about Ontario alone. It's now up to 40,000 beds, as Lisa Levin, of course, who is the executive director of Advantage Ontario, would tell you as well. Now in Winnipeg, it's about 300 beds. So it's quite different regionally. And then there are beds that don't even exist, for instance, in the north. So we can't even say they're missing. That's just not even on the table. So we're going to need to make sure that we are building for real, that we're helping with grants, for land grants, for people to do things. We're going to be flexible in different kinds of housing, and that the national housing strategy include aging, not just some rent subsidies, actually include aging. And that's how I would answer all three of the questions.
Wonderful place to leave off. Laura, appreciate you being on here again. Jodi, just a few closing thoughts on today's discussion.
Yeah, well, thank you to BC Cares for putting on this session. I really enjoyed the discussion and hearing from the other panelists. As Terry alluded to earlier, it's really too close to call as to who might form the next government. And, we see some really significant differences in the platforms. So ultimately, whichever party wins, we're certainly calling on them to not put long-term care aside and senior-related issues. It needs to stay at the forefront. It deserves to be at the forefront. And certainly I would call on everyone participating today to make sure that whoever your elected candidate is, that they continue to know that this is a critical priority for all of us in Canada.
Thanks very much, Jodi. Great thoughts. Terry, you have the last word from the panel.
Thanks, Mike, and thanks everyone for taking the time today. I would say that our hopes of being sort of front and center on this in this election are dimmed somewhat from from where we thought we were 6 months ago in any upcoming election. But some of the things that are in up and front and center are things like housing affordability. And how can we tie housing affordability to seniors care? There are many seniors out there that are overhoused, and many young people who can't afford to buy a house. Can't we connect the dots? Just like connecting immigration to HHR needs, let's connect the dots between young people trying to get into housing and older people who need a different kind of housing, whether it's congregate living, assisted living, long-term care, whatever it is, so that we can free up that space in our cities and communities across this country to make affordable housing for young people. We're not very good at comprehensive solutions to some of our major problems. So let's hope the next government thinks a little more creatively.
Thank you, Terry. Thank you, panelists. Thank you to Wayne Morishita, Lisa Levin, and Mary Donovan as well for coming in. And thank you, everybody, for joining us on this national conversation today. Remember that voting day is this coming Monday, September 20th. And be sure to visit bccare.ca for news and event updates. We have a long list of a great lineup of lunch and learn webinars coming up. And as well, we'll do a wrap up on this post. We have so many great comments in the chat box today. We'll take note of some of these things and try to incorporate them in our wrap up posts. I'd like to thank again our title sponsor, Arjoke, and Chris Pummel for joining us today, as well our silver sponsors, Pharmacy at Safeway and their representative, Anna Kaunaki, Manager of Business Development, and Care to Talk, of course. Jordan Schley, founder and CEO. Thank you to those sponsors, and thank you, everybody. Go vote and enjoy the rest of your week.
Bye, everyone.
Thank you.